All right, I've started and here is your question. You read this and you'll let me know. We'll move on. Yes?
Yes, yes.
Okay, yes. Second.
And what is the ADB? Distension?
Yep. Abdominal, brother.
Okay, okay.
Oh, okay, abdominal distension.
Is 11 and a half p.m. is the time of the RTA or?
Yes.
Okay.
Where have I written the time? Yes, it's the time when you are calling your consultant.
And the time of the RTA?
Yes, that actually my thing is in the way I can't see. Call at this when the patient has arrived. So it's almost the same time,
Okay.
approximately. Yes, you can say. Like after your first survey, now you're calling. So how much time do you need for first survey? 5 minutes?
Yes, yes.
Yes.
Okay. Is there another slide?
Yes, please.
Uh,
Previous?
yeah. Yes, I'm ready.
Okay. So if you've read and understood, considering it communication skill station, please begin.
Hello.
Hello.
I'm Dr. Ali Bade, working on the A&E. I'm in the Kerala hospital. I'm calling the trauma consultant to update him about the case. Can I check that I'm calling the trauma consultant?
Yes, doctor.
Yes, I have a patient, 20-year-old, presented to the A&E after an RTA. And on examination of the patient, there is open fracture of his left leg, and his GCS is 15 with a history of unconsciousness, a transient history of unconsciousness. And there is ablation in his abdomen. And on investigation, the X-ray confirmed there is a tibiofibular fracture, and the abdominal ultrasound show there is a free fluid in the abdomen, and also there is the fluid in the paracolic gutters. And the nurse calling me, and on examination of the limb, there is a pulseless in the extremity. So based on this, I'm worried this patient has arterial injury. I'm calling you to update you because this patient may need urgent surgical intervention.
Okay, doctor. You tell me that there is some abdominal collection and also the distal pulses you can't feel. So the foot is pulseless. Can you tell me what is the most urgent?
Yes, this patient has an open fracture of the tibiofibular fracture, and this may causing arterial damage. So this is the most urgent for restoring the arterial continuity.
Yes, and what about this abdominal collection?
The abdominal examinations, abdomen is lax, and maybe for conservative management.
Okay, so can you tell me why this vascular injury is more important than abdominal collection?
To save the limb of the patient from amputation.
And
Uh, and the patient is presented within the 6 hours. So we need to restore the continuity of the blood supply to save the patient limb.
okay, and what could be the possible cause of this pulseless foot?
Could be vascular injury. It could be spasm, arterial spasm. It could be kinking of the blood vessels. Also, maybe compartment syndrome.
Okay, so what do you think? What will the most common with this is vascular injury or compartment syndrome?
This is most common, most likely to be the vascular injury.
Okay, can you tell me what about the patient spine? Is he wearing a cervical collar or not?
Really, I'm not sure, but I will check it for sure. If it doesn't have the cervical collar, I will put the rigid cervical collar with the back and with some back and tapes.
Okay, and can you tell me what about the patient hydration?
Also, I will check the fluid chart of the patient, and I will update you.
Okay, so what will your plan of action next?
Okay, I will manage this patient according to the advanced trauma life support. I will start by checking the airway and breathing and circulations. And I will inform the orthopedic consultant and the vascular consultant. I will reduce the immobility of the fractures. Also, I will request the investigations, the CT for the abdomens, and also CT head on brain.
Can you tell me you are missing one important investigation? Can you name it?
Also, I will do duplex ultrasound for the limb.
Okay, doctor. But you have tell me this all detail of the patient, but why you are calling me at this time? How can I help you?
Yes, this patient may need urgent surgical intervention.
Okay.
Okay.
So for that, you told me that you are going to consult the orthopedic consultant and also the vascular consultant.
Yes.
So what will be my role?
Okay. To manage this patient may need urgent surgical intervention, and also we need the anesthetist and the also plastic surgeon.
Okay, okay, okay. Thank you. You can go with your plans of action. Okay,
Okay.
okay. Thank you.
Thank you very much.
What is the reason of involving general surgeon?
This patient may need a laparotomy because of the free fluid collection in the abdomen.
Okay. And how would you manage the free fluid in abdomen? Oh, okay, that you said emergency laparotomy.
Laparotomy,
But
yes.
how would you, like, for general surgeon, he has to rule out, he has to clean the wound and rule out the compartment syndrome, and also for intra-abdominal surgery. That three things general surgeon will be doing. Okay. Other than what other investigation did you say you'll ask for? CT angiogram for the
CT,
leg.
yes.
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 So how would you check if patient is hydrated enough?
I will check the fluid chart,
Okay. And
the central venous line,
yes,
also urinary output,
yes, good.
and the pulse and blood pressures and capillary fill time.
What blood investigations would you send?
I will complete blood count, renal function test, liver function.
Okay, and
Okay. And blood grouping and cross matching.
all right. What else would you do before sending the patient to the operation theater?
Yes, I will give patient IV fluid
Yes,
and adequate analgesia.
yes,
And
and
also for the wound, I will cover the wound by saline soaked gauze.
yes. Any anything for the fracture?
Yes, I
How?
will put traction,
Yes,
traction,
fraction.
traction, and anti-tetanus.
All
Also, I will
right,
give the patient antibiotics.
all right. And what about the wound of the patient?
What?
Wound, patient's wound.
Yes, I will cover the wound of the patient by saline soaked gauze and send the patient to the OR
Yes, after
for
doing
further.
the debridement of the
Yes,
necrotic
for
tissue. Right. Uh, okay, that's it then.
okay.
So I now Belvent. ISBAR. So all that you have to do at the end, you can summarize with the management. Right. Okay. Thank you.
Okay, thank you.